Welcome to Central Health. My name is Chris Ingersoll. I'm the Dean of the Herbert H. and Grace A. Dow College of Health Professions at Central Michigan University. With me today is Dr. Christina Bratlund. She's an assistant professor in our Department of Communication Disorders. She is a speech-language pathologist with expertise in swallowing disorders. Welcome, Dr. Bratlund.
Thank you, Dean Ingersoll.
Well, most of us wouldn't think about a speech therapist to handle a swallowing disorder. Can you explain that a little bit?
Certainly. This confusion happens a lot. So people come to me and say, well, I don't know why I was referred to a speech therapist. I have swallowing problems. I can talk just fine. But the same muscles that we use for talking in the mouth and the throat are also used in swallowing. And since as a speech therapist we were experts in these muscles and nerves, it naturally fell into our scope of practice to manage swallowing disorders as well.
Okay, well that makes sense. Well, where would we find people with swallowing disorders?
Up to 10 million Americans a year are evaluated with swallowing disorders. And we'd think, well, they might all be in the hospital or in a nursing home because that's typically where we find somebody with a disease or a disorder. But actually, a good majority of these people are out in the community. They're grocery shopping, going to work every day, visiting their grandkids, and they live with swallowing disorders on a day-to-day basis.
Really? Well, how would someone in the community know if they had a swallowing disorder?
Well, the biggest sign that people can tell that something's going down the wrong pipe would be coughing or choking.
So we all cough or choke from time to time. How much do we have to cough or choke, or are there other symptoms that we might want to pay attention to know whether or not we had a swallowing problem?
Excellent point. The frequency with which we cough or choke is a big indicator of whether this is enough of a swallowing disorder or if it's just something that happens from time to time, because you're right that we all do that. So if you're choking constantly, every time you sit down to eat, every time you have breakfast, a snack, lunch, dinner, and can identify things going down the wrong pipe, that's probably a good sign that something is going on with your anatomy. Or if you find it consistently with a certain food texture or a certain liquid, for example, every time you go to take a drink from your water bottle, if something goes down the wrong pipe. So if you can tie it to something, some routine, some frequency, then that's probably a good sign that it's a swallowing disorder. But as you mentioned, not everybody coughs or chokes as a symptom of a swallowing disorder. Sometimes it's just the matter that they take longer to eat. Sometimes it's recurring pneumonia. If somebody's had a pneumonia multiple times, been in the hospital for that, could be a sign that there's a swallowing problem. Or a wet, gurgly voice. Sometimes you go to talk while you're eating and you feel stuff still down in your throat, or you just feel like it never fully gets swallowed down. If food spills out the front when you're eating, or even just something as maybe not even noticeable as a change in your diet, a change in certain foods that you eat.
Interesting. So what kind of changes could you make?
Somebody might cut out tough meats or dry crumbly substances like chips and pretzels and popcorn. These tend to be more difficult to eat for controlling them in the mouth. So things might be substituted like fish. It's still meat, but it's a softer meat, or lasagna, regular foods. So you might not even realize that you've made a change in your diet, but you're starting to avoid some foods. Salad is another one that people tend to avoid as they're having swallowing problems.
I can relate to what you're talking about. I have a family member who dislikes going to restaurants because of choking problems.
That's what we see a lot. So as you have difficulty with the eating or the swallowing process, you start not enjoying it. I mean, imagine if you coughed or choked or felt uncomfortable every time you were eating, you just don't enjoy the eating process as much anymore, and so you start to avoid eating, which can contribute to a general weight loss. Or you avoid social situations of going out to restaurants, going out to eat with family. And that can be really hard on people with swallowing disorders because it severely impacts quality of life. As that's going out to eat or spending time around meals is so central to our American culture and the relationship building that we do.
Well, what would someone do if they or someone they knew felt they had a choking problem?
So you would want to get a doctor's referral. You just ask your general practitioner, any of the doctors that you go see. You could say, I think I'm having some difficulty swallowing. I feel like food's getting stuck in my throat, or I'm coughing a lot when I swallow. Could you refer me to a speech therapist? And again, there's that confusion of the speech therapist, but like I mentioned, speech therapists are the experts in the swallowing disorders. And they might have some other doctors they want to refer you to also, but getting a speech therapist evaluation is really helpful, and to have an individualized assessment of if what you're experiencing is significant enough to be a disorder, or if maybe there's just some quick management strategies and tips that we can give you to help make eating a more positive experience.
Well, good. Well, if you can get a doctor's referral, is that something they could come to the Carl Center and get treatment for?
Definitely, certainly. I work here at the Carl Center, and I would love to work with more clients in the area of swallowing disorders. So as an initial evaluation, they could come, or if they have a diagnosis of swallowing problems in the past and have worked with a speech therapist, and maybe they want to come for a tune-up visit, or just to remind me of some of these things, or if they've had a change in their swallowing since that time, we can do that here as well.
Great. Well, thank you for the information, Dr. Bratlund. I'd like to ask you a few questions about your specific research. If the viewers would like to join in and listen to our conversation, please go to www.chp.cmich.edu and look for Central Health.